Hi, my name is Rhea Goswami, and I'm a sophomore at Thomas Jefferson High School for Science and Technology. This video is about simplifying COVID-19 for the general public. As most of us are practicing social distancing at home, it's a good idea to find out more about this novel virus. So, what is coronavirus? The official name of the virus is Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2, and the official name of the disease is COVID-19. This disease was declared on March 1st, 2020 by the World Health Organization, or WHO, to be a pandemic. There have primarily been 7 human coronaviruses that have now been identified, with COVID-19 being the most recent one. They're mainly zoonotic, which means that they transmit between animals and humans, but mostly only affect their specific animal host. But rarely does coronavirus evolve to spread among such a large number of people. But this was the case with Severe Acute Respiratory Coronavirus, or SARS-CoV, and Middle East Respiratory Syndrome Coronavirus, or MERS-CoV. There are 3 main factors in a pandemic: the pathogen, which in this case is SARS-CoV-2, the environment, which is population density, weather, and culture, and the host, which is population immune status. But why is COVID-19 generating so much fear? The main concern is that unlike the influenza, there is no vaccine or specific treatment of this disease. Additionally, it is as or even more transmissible than influenza. Since it's a new virus, this means that no one has prior immunity, which means that the entire population is potentially susceptible to this disease. So now we transition to the actual biology of this disease. It's a virus, and its structure has cellular receptors, or spikes, that form a crown-like structure similar to a solar corona. The cellular receptor for the virus is angiotensin-converting enzyme 2, or ACE2. Entry of the coronavirus into our cells depends on the binding of a viral spike, or S proteins, to cellular receptors, and priming by host cell serine proteases, which are enzymes that break down proteins and peptides. Binders with enhanced affinities to the coronavirus receptor may deploy decoy ligands or neutralizing antibodies for suppression of the viral infection. SARS-CoV-2 uses ACE2 receptors for entries of serine protease, TMPRSS2, for S protein priming. The TMPRSS2 inhibitor is approved for clinical use, which blocks the entry of the virus and may be considered as a treatment option. Mounting evidence points to the role of hyperinflammation in severe cases of COVID-19, sometimes manifesting as cytokine storms. And cytokines are cell signaling molecules. Cytokines levels are elevated, and the majority of patients that show such elevated levels die in the ICU despite using ventilators. The way that COVID-19 spreads is mainly from person to person through close contact with one another. Primarily, it spreads through respiratory droplets produced when an infected person coughs or sneezes, and then the droplets land in mouths or noses of people who are nearby, and then are possibly inhaled into the lungs. People can also get it by touching a surface or an object that has a virus on it, and then touching their mouth, nose, or eyes. The average number of people infected by each patient is 2.2. The serial interval, which is the time duration between a primary case patient or infector to a secondary case patient or the infectee, for COVID-19 is 3.96 days, which is lower than the mean serial intervals for SARS, which was 8.4 days, and MERS, which was 14.6 days. SARS-CoV-2 survives on aerosols for at least 3 hours, remains detectable for up to 4 hours on copper, up to 24 hours on cardboard, and up to 3 days on plastic and stainless steel. But what about warm weather? COVID-19 may transmit somewhat more efficiently in the winter than the summer. We expect that COVID-19, as a virus new to humans, will face less immunity and thus transmit more readily even outside the winter season. Predecessors to the coronavirus were more linked to more probable emergence of asynchronous seasonal global outbreaks, much like other respiratory diseases. People in temperate, warm, cold climates are more vulnerable. Then those in arid climates follow next in the vulnerability scale. Then the disease will marginally affect the tropics. The median incubation time is about 5.1 days. 97.5% of those who develop symptoms will do so within 11.5 days of infections. But the symptoms have such a wide range. Some people don't show symptoms, while others can show mild to moderate symptoms such as fever, sore throat, cough, chills, and muscle ache, while there are severe symptoms like pneumonia and respiratory distress, and even death can occur. How lethal is the coronavirus? Well, it's still too early to tell for COVID-19, but based on the aforementioned coronaviruses, SARS killed about 10% of its patients, and MERS killed about 30% of its patients. On March 3rd, 2020, the WHO estimated the death rate of COVID-19 to be about 3.4%. COVID-19 is substantially less lethal than SARS, but more infectious. Additionally, it's substantially less infectious than seasonal influenza, but more lethal. The degree of severity has been severely exaggerated by the data so far, with most extreme and fatal cases being reported compared to mild cases. Previously, it was thought that children were not as easily infected, but recent evidence from Shenzhen suggests that children may be infected and shed the detectable virus at about the same rate as adults. Children of all ages and genders are susceptible. Lastly, an audit of 3,883 patients with a confirmed COVID-19 in the UK showed that the median age of infection was about 61 years, and 72.5% of the infected patients were male. Obesity is also a risk factor. Some preventive measures include washing your hands with soap and water for at least 20 seconds frequently. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, so practice social distancing. Stay at home if you are sick. Clean and disinfect frequently touched surfaces and objects. Lastly, practice safe food practices. But what about masks? If you are healthy, you only need to wear a mask if you're taking care of a person with a suspected COVID-19 infection. So wear a mask if you're coughing or sneezing. Masks are only effective when used in combination with frequent hand cleaning with alcohol-based hand sanitizer or soap and water. If you are wearing a mask, then know how to use it and properly dispose of it too. So, tests. They aren't widely available in some areas, but there are two main types of tests, molecular and serological tests. The molecular tests detect the actual SARS-CoV-2 virus with respiratory samples collected during the acute phase of the infection. Scientists conduct RT-PCR for specific SARS-CoV-2 genes. It's tested typically on people who show symptoms and can diagnose current cases of COVID-19. The other type of test is a serological test, which detects the presence of antibodies that are used to fight against the SARS-CoV-2 virus using a blood sample collected 14 to 21 days after symptoms are shown. It mainly detects IgG or IgM antibodies using recombinant antigens derived from the spike or S protein of the SARS-CoV-2 virus. It is a method of population surveillance to identify people with the past infection. But surely there has to be some effective drugs, vaccines, or therapies against the virus. Well, the WHO listed 35 candidate vaccines developed against COVID-19 as of March 10, 2020. There are no effective drugs on the market against the virus, although drugs are being tested. There is, in fact, a rapid launch of multiple trials. Several international research groups are working on a vaccine for COVID-19. The WHO launched a Solidarity trial, and Oxford University launched a recovery trial, but they play a limited role. Thank you so much for listening, and this certainly would not have been possible without the guidance or materials of Kamal Veer Saini, who is an esteemed Senior Medical Director in Oncology at Covance. I hope this cleared up COVID-19 for you just a bit more. If you have any questions or comments, email the link down below or comment in the comments section. But most importantly, share this video so more people can learn about the novel virus.